This is a quick refresher video on first aid for diabetes. Diabetes is a serious condition caused by the body not being able to produce enough insulin to regulate blood sugar. So it's normally controlled in three main ways. The first is diet, reducing the amount of sugar that's eaten. The second is tablets. Those have a small amount of insulin to help reduce sugar in the blood alongside the low sugar diet. And the third way is with insulin by injection, and sometimes now via a pump that monitors the blood sugar. First aid for diabetes may be needed for two main reasons. The first is hypoglycemia, or low blood sugar, and the second is hyperglycemia, or high blood sugar. And people with diabetes might wear medical jewelry. So in a first aid situation, you can always check for a bracelet or a necklace, or you can ask a conscious casualty or the people where they're with if they have diabetes. So let's start with hypoglycemia. This is when the blood sugar falls very low. It can be really dangerous for the brain because glucose is its source of energy. So brain cells become starved of energy, essentially. It's caused by the casualty not eating enough, over-exercising, or injecting too much insulin. With low blood sugar, the signs and symptoms we need to look out for is people deteriorating very quickly, so minutes rather than hours. They might be weak, dizzy, or confused. They might have slurred speech. Their skin would be pale, cold, and sweaty. Breathing tends to be shallow and fast, and the pulse racing. It's important to note that can be confused for drunkenness, so just to be aware of that when you're in a first aid situation. The treatment, if the casualty is conscious, you need to aim to give them 15 to 20 grams of glucose, so that's roughly a 200 milliliter glass of fruit juice or a fizzy drink, 4 jelly babies, or 4 teaspoons of sugar. If they respond quickly, you can encourage them to rest and have more food or drink. You want to stay with them until they're fully alert and encourage them to seek medical help. If they don't respond to that within 15 minutes, you need to call 999 and consider if there could be another cause for the symptoms. And as with all first aid situations, if they become unconscious, you need to open the airway and check for breathing, and then take the appropriate action. So let's move on to hyperglycemia. This is when the blood sugar levels get too high, causes acids to build up and creates signs and symptoms that are a direct result of the body trying to get rid of that acid. It's caused by the casualty not managing their sugar levels with the diet or insulin controls that we mentioned before. So with high blood sugar, the signs and symptoms to look out for, they'll deteriorate much more slowly. So this could be over several hours or even a day or two. They may become drowsy and lethargic. The skin, in contrast to hypo, that would be dry and warm. The breathing would be more deep and sighing breaths. Again, the pulse would be racing. And if untreated, they will become unconscious. So some other things to note, they may be really thirsty or really hungry. They may be urinating a lot. And there's a key thing to look out for is they could have a fruity or a sweet smell on their breath. The treatment in this situation is to arrange for the casualty to see a doctor as soon as possible. And again, if they become unconscious, you need to maintain the airway and breathing and call 999 for emergency help. So just to sum up, a casualty with diabetic symptoms can be hypoglycemic or low blood sugar, or they can be hyperglycemic with high blood sugar. The first aid we provide is aiming to get them back to normal blood sugar levels. And as in all first aid cases, if the casualty is seriously unwell, we should call 999 so they can get the care they need.